Hi everyone, greetings from NSN Hyderabad. As we are aware today, one of the industries which is in great demand for skilled workforce is the healthcare industry. Due to the impact of COVID, the second phase of COVID particularly, there is a huge need of skilled people who can handle the patients, who can work in a safe environment, and also who can use many equipments and handle the latest technologies that is being used in the healthcare sector. So with this in mind, we thought we will catch up with the Healthcare Sector Skill Council in India. We have with us Mr. Ashish Jain, who is the CEO of Healthcare Sector Skill Council, and he's going to share with us the current situation about skilling in the healthcare sector and various initiatives that are going to be taken by the Healthcare Sector Skill Council to meet the challenges. And at the same time, he's also going to tell us some of the top job roles and the need for skilled people that is going to come up in the next few months and years. Welcome to this talk, Mr. Ashish Jain. We are really happy to have you here and learn from you about the current situation and how the need for skilled workforce is growing by the day and how we are going to address this need. So let's get started by asking you a very pertinent and important question. How has COVID-19 impacted the healthcare industry in terms of, let's say, need for skilled professionals?
Uh, See, I would say, nobody has expected the magnitude, such a big magnitude for COVID to impact our country in this manner. And I think you will agree with, and very many experts have actually, said this, that kind of magnitude with which we're impacted. I think no infrastructure, no manpower in the world could have faced this kind of an onslaught. I would say, given the kind of workforce which we had in the healthcare and the skill set which we have in healthcare, I think kudos to our healthcare professionals, doctors, nurses, allied health people, and support staff, others who have been managing so well given the constraints what we have in terms of the we are working today. Having said this, I would like to say in terms of the skill set, yes, because the magnitude was so huge, which definitely leaves a lot of room for us to create, skilled workforce which is required today on ground. Uh, we always have spoken about the multiple studies been done about the kind of, the shortages in terms of the numbers. If we talk about technically numbers of doctors, nurses across, as per the WHO standards. But in spite of the fact that we have shortages of these people, and I think government has taken various initiatives now to augment the and enhance the number of these skilled person in the healthcare. Number of medical colleges have come up. Similarly, nursing has been also provided multiple incentives to see how more nursing people can join in. Uh, but there is another cadre which is very important, critical, which is the skilled healthcare workforce support workers, which can actually take away a lot of burden from both doctors and nurses, which can then devote more time for the on with the patients, which are the very mundane jobs or administrative jobs, or some jobs which can be shifted from doctors to nurses and nurses to the allied health and the support staff. So I think there's a large need to focus on this cadre now. We have always focused on our doctors and nursing cadre, but I think now we need to focus on this cadre of support staff. If we can build the support staff, if we can create a recognition for the support staff, I think we can bridge this skill gap quite easily and quite early in terms of estimations what we have. So if you look at the certain estimates, probably the people required through one of our study which we did by 2030, I think we have expected that 2.6 million people in the support staff would be required by 2030, which means we start training now. We are sitting in 2021. Over the period of 9 years, you need almost 26 lakh people or 2.6 million people, which is which is possible and can be done. The kind of support we are getting and should be done. But yes, what I'm trying to say here is that there is a requirement, given that the kind of the number of patients which are coming in. We also need a lot of people in this cadre which can actually bridge in some gap for the other skilled workforce and can support our existing doctors and nurses also.
Yeah. So I understand the need, and also I think this is going into areas like there is a great demand for home healthcare as well, mobile healthcare, and there are so many innovative ways of offering healthcare today, post COVID or during COVID, and maybe the situation that is following the present crisis. To connect with this, I would also like to ask you another important question, which is to do with reskilling and upskilling of the existing workforce. So from the Sector Skill Council, how are you taking these initiatives forward? Let's say, how do you interact with the training partners or institutions and organizations who are, aligned with your vision to offer various types of skilling on the job?
So we're in continuous touch with various stakeholders on ground, which is, as you rightly mentioned, the training partners, but at the same time with the experts on the field and the hospitals and the healthcare institutions. So we're trying to, we keep assessing the requirements from the healthcare sector and what is that we have, which we can provide that kind of skilled workforce. In terms of the the training partners, etc., we are in continuous dialogue with them to understand what is that they could deliver. We try and handhold them to bring it to the level where we want them to do. So what we have started doing is, there, as you understand and you are aware, we have a certain job rules which go through a certain process and become NSQC cleared job rules.
Yeah.
But given the current need, there may be certain trainings which our partners are doing today, which are not NSQC cleared or not NSQC approved job roles. So what we started working with them is, can we align with our partners who are offering these roles in the current times, and we are trying to see how we can work with them on those roles as well. So what have we have started doing is, in addition to the NSQF aligned roles which is being done, we are also trying to see how we support our partners in the non NSQF aligned roles as well, which they are doing, meeting the need for the sector in the current times. So that's also we started. We are also looking at looking at some online programs which can contribute in current scenario, because trainings are not being held up right now because of the lockdown. It can't, a student cannot physically come to your training center. So we are also trying to see how we can go in a blended mode. How can training be provided online or off-site also, if if possible, whenever possible. So we are trying to see how we can utilize this time to the best possible extent, and we do not waste this lockdown period just to say that keep sitting. And we are trying to just build capacity of existing healthcare workforce through these online mechanisms, because people who are already trained may not require everything to be taught to them in the skill center on the in the center itself. They can learn few things online, which may be very helpful for them to work at the COVID care centers or COVID management with the doctors and nurses.
Uh, Now, connected with the online learning, since you already mentioned that efforts are being made, we also came to know about this I got platform, which is available in the public domain, and that has quite a few healthcare related courses. We are not aware if this is being used by the training partners, but we thought that was one of the avenues for people to learn on their own. So besides this, what are other platforms and what are other initiatives from the Sector Skill Council? Have you already got such platforms which are being made available for the training partners and students?
So I think you very rightly mentioned IGOT is something which has been created specifically for this purpose by the government of India. And I think there are multiple courses which are aligned to tackle COVID, how COVID can be managed. There are relevant courses that they picked up and put up there.
Yeah.
Similarly, I think there are multiple channels, platforms through which this kind of training can be done, which is like, we also have started doing our own online programs. Now we had our own platform through which we can actually provide these kind of online programs. We had putting up programs like infection control, which is the must, in the current time. So that is available online. Similarly, earlier we ran a program, online program, which is COVID Warriors, which is again for healthcare professionals to be, upskilled and train them into the existing healthcare professionals would have taken it for their upskilling kind of a thing and be prepared for how to deal with COVID. So I think there are various such platforms, and everyone is trying to, help out and trying to see utilize the online mechanism given the current scenario. You'll find most of the partners are also coming up with their online platforms. Like we mentioned about our partners which are working with us. Many of them have developed their own portals now, which actually has their own platforms, LMSs through which they run multiple online courses, and short duration and long duration both courses right now.
Okay. I think that's going to address the need for online skilling in a very big way, at least till the time we get into the face to face or proper blended mode of learning. With this, I would also like to know from you if you have to list out, let's say, top five job roles today. Of course, this is automatically, it means that in the COVID scenario, so what would be the top five job roles which will be filled where we need a lot of people? Let's say somewhere somebody is setting up a COVID care center and then they are asking for immediate fulfilling of few job roles. So what would be such job roles?
So I'll not go into the specialists and doctors and nurses because that's not what we deal with. Of course, those are required as a first healthcare professionals to run any of these centers or any COVID facility. But apart from that, if we talk about what we work on from our purview, I think the roles which are required most is one is what we call general duty advance,
Okay.
which is in the critical care side. Of course, general duty advance is also required in equal numbers. Then we have, like you also mentioned, in the previous question, that going forward, home care is going to be one of the big opportunity and big, things. So home care aides are also one big in demand right now.
Mhm.
Then we have emergency medical techniques, which is, which provide emergency care, transport patient from, the one facility to other facility in ambulances. They're largely deployed in the ambulances or in the ER, etc., at the hospitals. So this is the another one. I think one great demand which is emerging now, and I think you must have read some in the newspaper also, which is coming from the medical equipment side, which is about technicians which are required to install, maintain, and repair the medical equipment. So we have a lot of equipment, which is around the country right now,
Yeah.
which can be repaired and maintained and can be utilized quickly. So I think there is a clear demand for such kind of people which is emerging, and very, very critical important demand which I think many of you must have realized, that which is very near to you also, every one of us is a person who comes to collect sample. We
Mhm.
call is a phlebotomist. So
Yeah.
I think this is one clear demand which we are getting, that people should be available to collect sample from home, facilities, anywhere. So they are actually, people are trained to collect sample, store it and transport it to the lab. So this is another. So I believe these are the 4 or 5 roles which would be in great demand in the current times.
Mhm.
And just to summarize, there's some people which are required at the facility itself, which is general duties assistants and general duty advanced for critical care. Then we need some people at home we can support post COVID or during COVID for home care. Then we need people for the our equipments maintenance and equipment repairs, etc. And the one is for emergency care. So I think this will be the bouquet of all 5 kind of roles which may be required in large numbers at given at this point of time. And more so because what we are seeing right now, the COVID is, although is coming to in the cities, it's been showing downward trend, but at the same time there is a fear that it may have been increasing trend in the rural side now. So we would need these large number of people in the rural side at the public health centers, sub centers, or district hospitals, along with different private hospitals as well.
Yeah, very rightly you said. You also mentioned the rural and the public health. I was coming to that in my next question. How are we reaching out to these places, Mr. Jain? Like now you're saying it is, yes, it is spreading to towns and we need more care centers there. So how do you think skilled people will be made available at such centers? And also, I would say adoption of technology as well.
So idea is to, one is that we need people at these sites in the shortest possible time. That is one.
Mm.
And if we need people in the shortest possible time, how do we create them in short possible time?
Yeah.
So what we're trying to work on a plan currently is this, that we pick up people from respective districts only
Mhm.
and nearby areas and train them for deployment in the nearby areas only. So that person doesn't have to travel from one place to another. So let's say if there is a person who is trained in a district A and he doesn't have to come to, let's say, any metro or Delhi, Bangalore or Chennai, I think he will be much satisfied at a lower salary also at there. He'll be near to his near dear ones as well. And I think he can provide better services because he's coming from that particular community or particular district or particular area itself. So focus is on that. I think government is also trying to devise a composite scheme where they are trying to seek demand from the at a district level, and then align the trainings at the district level to see that people are trained and deployed immediately in those districts along maybe at the PSCs and the sub-centers and district hospitals as well. So in terms of technology, I think the thought is that we should use, online mechanism of certain part of training, and it could be blended training, where certain would be an online and then blended in the sense it will be on-site training also, where certain portion hands-on skills will be provided on-site, and which will be then the trainees would be deployed for on-the-job training in the hospital for a few months, so
Yeah.
that they are actually available in the hospital at the earliest, and they also learn on the job as well.
Mhm. Yeah, I understand from your website that Healthcare Sector Skill Council is also now responsible for Ayush, kind of medication, the various other indigenous medications. So, what are the steps being taken there? Because one part of COVID is also to do with becoming immune and strengthening our immune system. So, are there any initiatives and programs being initiated by Healthcare Sector Skill Council in this direction?
So I think very good question. I think you have gone researched well on HSSC. So not many people know about it, that we are working on Ayush also. So I think we started working on Ayush for quite some time, and it is the mandate which is added to Healthcare Sector Skill Council now. So we are working very, very closely with the Ministry of Ayush on developing the requirements for the Ayush. And as you wanted to ask specifically for the COVID issue, so what we did is we started with a small animated video, which is based upon our Honorable Prime Minister, talk at Man Ki Baat, where he spoke about how Ayurveda can be utilized for developing the immunity. So what we did is we created a small animation where we have actually put in what kind of immunity boosting measures could be done. We have done it with Ministry of Ayush, which has been circulated well. People have listened to it, seen it, so a lot of hits have been through that. Also, what we are doing is we are trying to work on developing multiple roles for Ayush now, which may have impact. So, for example, like we have under Ayushman Bharat, we have the health and wellness centers. So under the Ayushman Bharat, there is a proposal to set up 1,50,000 health and wellness center across country. Out of those 1,50,000, 12,500 would be dedicatedly for Ayush only. So we are working with the Ministry of Ayush now to see how we can supply or how we can develop the workforce for those health and wellness centers, which would be not necessarily in the metros, it will be far-flung areas also, so that people can actually utilize the services of Ayush also. So we're working very closely with the Ministry of Ayush to see that how do we train those people who can be deployed at this health and wellness centers, which can play a key role in terms of current times as well.
Okay. Okay, so besides the points we discussed, I would also like to know from you as one of the last points that is very important for people who are watching this. It could be your message to the young professionals who wish to join this particular sector in various job roles that you just mentioned, and there could be other job roles which they can find out from the website. What would be your message to them in a scenario like this? And also in the future where healthcare and technology are getting very closely integrated. So could you please share some points on these lines?
See, healthcare is is a sector, is an area which I think gives you a lot of satisfaction. I think other than the salary, other than the remuneration, which is equally important for youth which comes into the sector, when you see a smile on a patient, when you see somebody, when you save a life, the kind of satisfaction derived from that one activity is much beyond what you actually gain through your salary or your remuneration actually. So that's the additional benefit which only this sector can provide you. I think kind of satisfaction you can get from saving one's life, I think no other sector can provide you that one. Secondly, very importantly, I think this sector, people who are working in this sector are very, very, highly valued in the society. Even if it is the lowest, rung, which is at the bottom of the pyramid. But the moment you're in the health sector, I think you are always treated highly. You are always respected. Say, for instance, I'm just, trying to give you a hypothetical situation here. Let's say we have a GDA who is working in a hospital X and maybe, in a PSC or a CHC or a rural area. But for village, he is like a doctor. So he is treated like, ki bhai doctor sahab aa gaye. So it's like Sahab, which is added, so that's a lot of respect and value to the profession. So healthcare itself is a very valuable profession. Everyone who associates with it get that respect and value for that. Of course, there are a lot of technology which is being brought in into it. We're talking about artificial intelligence, machine learning, robotic surgery, everything, which is also well connected to technology, also, which is very appealing and attractive to the youth as such. So they will find a use of technology in every aspect of healthcare going forward. Uh, to my mind, this is one of the sectors which I think youth should be looking for, because they have everything what they would look for. They have money in this. They have a lot of respect, influence in the society. So I think that's all which a youth in a sense looks for. It has technology component to it. So I think you should definitely look to the healthcare sector as one of the sectors for them to be working in for.
Okay. Thank you so much, Mr. Jain, for sharing your views and also giving us such a clear picture about the skilling initiatives and how things are getting ramped up to address the challenges. And like you said, the magnitude of the pandemic, which has caught us unawares in a way all over the world. And we are doing our best to, address the challenges through skilled manpower. Thank you so much. I look forward to be in touch with you. Thanks a lot.
Thank you. Thank you.
So friends, I hope you found this interview very useful and the conversation we had must have really helped you in learning about the industry, about the healthcare industry in particular here. So I would request you to subscribe to our YouTube channel by clicking the bell icon and look forward to many such conversations which will help you learn about various industry sectors. So please don't wait, go ahead and click the bell icon, subscribe to our channel, and also please spread the word among your friends, relatives, family members, etc. Telling them about the importance of skilling, and get back to us by commenting, sharing your views, your questions, your opinions in the comment section here, and use the description box also to learn more about skilling, about the initiatives that are taken from NSN. I'm so glad you're with us. Thank you so much. And I wish you all the best, good health, happiness, and be safe. Thanks a lot.